Hello friends, I'm Dr. Ankit Goel, consultant psychiatrist and your faculty for psychiatry. So today in this video we are going to discuss an MCQ with the important theory associated with it, and we are going to learn it in a fun way. So let us begin. Now, an adult male is brought to a psychiatric OPD by his wife, and the wife says to the doctor, "Doctor, he's talking very odd things since past 3 months." The doctor asks, "Please elaborate the problem." The wife says that whenever his phone rings, he says he hears voice of his dead father talking to him. Now, let us put this situation in a MCQ form. So the question is, a 40-year-old male is brought to hospital by his wife as she has noted a change in his behavior for the past 3 months. Patient reports of hearing his dead father's voice whenever his phone rings. Which of the following symptom is described in the patient? So the options which are given are A. Reflex hallucination, B. Functional hallucination, C. Extracampine hallucination, and D. Otoscopy. So the correct answer of this question is option B, that is, it is a functional hallucination. Now let us discuss what is functional hallucination. Now, functional hallucination is a type of special hallucination. We all know what is hallucination. Hallucination is a false perception without a real object or a real stimulus. Now, functional hallucination is a special type of hallucination in a way. Why? Because there is requirement of an external stimulus to provoke the hallucination. Now, also very important to remember that the stimulus in one sensory modality. Now, sensory modality means, for example, based on our sense organs, various sensory modalities will be auditory, visual, olfactory, gustatory, and tactile. So these will be our sensory modality. So a stimulus in one sensory modality produces hallucination in the same sensory modality. So if the stimulus is auditory, so the real external stimulus is auditory, so it is going to produce the hallucination in the same modality, that it is going to produce auditory hallucination. This is what it means. So this is when we say that it is functional hallucination. So again, let us discuss based on this question only. So the patient says whenever his phone rings, he hears the voice of his dead father. Now the dead father's voice is the hallucination, okay, and it is being provoked or it is being produced by a real stimulus. So we say that the cell phone is ringing, it is a normal perception, while it is producing hallucination in the same sensory modality. So one is hearing the normal perception and then it is producing the hallucination in the same modality. So it is producing a auditory hallucination. This is functional hallucination. Another example can be, the person may say, whenever I see a red light, which is a real perception, person may say that I see a man crossing by. So now here the visual real stimulus is provoking a visual hallucination, so it's in the same modality. Then we will say it is functional hallucination. Now, so also very important to remember is that in functional hallucination, the normal perception and hallucination are experienced simultaneously together. So in the previous example, on this example, the person will be hearing both the ringtone as well as also the voice of his dead father. So there are both presence of both normal perception and hallucination are occurring together. Very important. Now, similarly, then what is reflex hallucination? Interesting to compare functional hallucination and reflex hallucination. Now, important to remember that it is also known as morbid synesthesia, an important MCQ. Now, what is reflex hallucination? Again, in reflex hallucination, which is also a type of special hallucination, external stimulus is required to provoke a hallucination. So similar to functional hallucination. Now, very important to understand here is that stimulus in one sensory modality produces hallucination in a different modality. So this is the difference from functional hallucination. So let us discuss with an example. So again, let us suppose a patient says that whenever I hear my ringtone, I see a man crossing by in the room. So the person is hearing a real perception. So this is a normal perception in which modality? In auditory modality, and the person is the hallucination. He is seeing something. So the hallucination is occurring in another modality. It is occurring in visual modality. It is a visual hallucination. So this is reflex hallucination. So this is the difference between functional hallucination and reflex hallucination. Now, other than these two, so let us just compile the list of special hallucination. So two we have discussed: functional hallucination, reflex hallucination. Then others are extracampine hallucination, autoscopy, and hypnagogic and hypnopompic hallucination. So these are the important 5 special hallucination. Thank you for your time. Please like and subscribe our channel, which will motivate us to put more such videos.